ED, erectile dysfunction, from flop to the top with no awkward vibes. Joe coming at you, pharmacist. Kind of an awkward topic, but I want to go through and talk about this because this is a big concern for men 50 plus. And in my series, Health Hacks in a Flash, I think this is one I have to cover because it's that big of a thing. Men over 50 typically can start to show some signs of erectile dysfunction, and it's not very uncommon. So here's the thing, it can affect performance due to the reduced blood flow, stress, and other health issues that cause it. But the overall thing is that it's caused typically by aging arteries, diabetes, or sometimes high blood pressure, and stress can facilitate the onset of this, especially occasional. But chronic problems in this area usually indicate there's something else going on here that needs to be taken a look at, that maybe there's some ways to resolve it. Now here's some hacks, here's some ways to do it that I think you're really not thinking about yet, and that is aim for 30 minutes of brisk exercise, well, brisk walking anyway, but I think you need to go with more than just brisk walking to get some exercise to really up. Cycling, swimming improves the circulation and heart health for better chances of not having this erectile dysfunction. Now, caution, if you're doing biking, make sure you understand there's something that can cause some damage to the perianal nerve that can cause some problems there. That's a real biggie. Quit smoking. This really definitely can help reduce it, damages blood vessels, and it really causes some problems because of nitrous oxide needed for arousal. Please, smoking is probably going to be a problem you got to think about. Heart healthy diet. People eat the wrong foods, believe it or not, and your vascular function is usually improved when you're eating things that are rich in antioxidants and also not, some of the fatty foods. So fruits, vegetables, nuts, fish for better vascular health. Stress is a big one, so we really need to think about that. And weight loss is another big one that can help. That's a hack that people don't think about. Maybe if you lost some weight, you would have a better chance of this. So I'm going to go through and talk about too, if this, again, if it's not occasional, but if it's continual, then you need to think about some meds. And the doctors right now have a lot of meds in their arsenal they can use for this. I want to caution you as a pharmacist, so these work very well for most patients that I hear, but there's some side effects and you have to really not use them too frequently. But there are some side effects that you have to be aware of. One is what they call priapism, which is erections that don't go away. That is a real problem. But there's other ones. There's some visual disturbances and there's some other things that can be done that could be a problem. So you have to check with your doctor before you go on them. So, but you may have to go with these. Other options in the marketplace, but typically these are the go-tos. So hope that tip helps. Try some holistic approaches first. And if it's still going on, then you got to see a doctor. So as always, come to our website and to our YouTube channel where you can get more men 50 plus health hacks in a flash.